Hi everyone. So today we are going to talk about preparation of plasma for coagulation studies. Before we can proceed with the coagulation testing, the first step that we need to perform is specimen collection. The most essential goal of specimen collection for coagulation testing is what we call the non-traumatic venipuncture. So through the non-traumatic venipuncture, it eliminates premature activation of the coagulation process prior to testing. So the causes of premature activation of the coagulation process are the following. First, we have contamination of specimen with tissue factor or tissue thromboplastin because of tissue juice. Next, we have contact with surfaces of inappropriate specimen containers like um, collection tubes that are made of glass or clot-promoting silica particles. That's why for specimen collection involved in coagulation testing, we are going to collect our sample using a plastic test tube. Next, we have improper temperature because there are some factors in the coagulation cascades that may be inhibited or accelerated if the sample is exposed in improper temperatures. And lastly, hemolysis. So, a hemolyzed specimen is an inappropriate specimen for coagulation testing. The pictures shown on this slide are examples of situations that may promote premature activation of the coagulation cascade. So you have here the first picture here. It could be that the process of collecting a sample is traumatic. So if it's a traumatic venipuncture, there is a possibility for the introduction of the tissue juice into your sample, or it could promote clot formation. And then we have here picture of tubes showing you hemolyzed specimen. So again, hemolyzed specimen is not unacceptable specimen for coagulation testing. There are also technical errors that are involved in the collection of the sample that is used for coagulation testing. And when these technical errors are seen or included, the sample may not be an appropriate sample for the test. So what are some examples of these errors? So you have prolonged application of tourniquet on the arm of the patient. So as a phlebotomist, you have to be aware that the application of the tourniquet on the arm should not exceed 1 minute. We also have presence of moisture or contamination in the needle, syringe, or blood container. Another error would be using needles with too small bore. So you have to also check the gauge of the needle to be used for blood collection, because if you're going to use a needle that has a very thin passageway for the sample, it would promote clotting or hemolysis. Next, frothing of sample due to entry of air. Frothing is just basically presence of bubbles in your sample, and you have expelling blood from the syringe through the needle. So other medical technologists would opt for this procedure of transferring the sample from the syringe to the tube. They just directly or immediately insert the needle into the evacuated tube and allow the vacuum to suck the sample from the syringe. Now, sometimes, or there are cases wherein after the sample has been transferred from the syringe to the evacuated tube, um, the sample may be clotted or sometimes hemolyzed. And if that happens, that would also lead to the premature activation of your clotting factors. And lastly, excessive and vigorous mixing of blood with the anticoagulant. So the blood collection tube needed for collecting a sample in coagulation testing is your light blue top tube, and the anticoagulant present there is your 3.2% sodium citrate. Now, for coagulation studies, and if the sample is collected using that tube, the required number of inversions is 3 to 4 gentle full inversions. So it says gentle, so please do not try to agitate vigorously your tube after collecting your sample, because again, that would also promote activation of your coagulation cascade. There are special considerations in the collection of our sample for the coagulation testing. So the recommended collection method is the evacuated tube system, which is also a closed system, which means to say that your sample is free from contamination or protected from contamination. However, there are also alternative methods that are available. So first, we have the two syringe technique. So this method is recommended when only coagulation tests are ordered. So if there are no other tests that are required from the patient, the medical technologist could go for the two syringe technique. However, this technique is not recommended or not preferred because it employs an open system. So what the medical technologist would do is that um, using the needle, using the syringe, he inserts the needle to the arm of the patient, and then if the first syringe is already full with the sample, the medical technologist will have to remove the barrel of the syringe, and he or she should get another empty barrel and attach it to the needle. So if you try to imagine it, it's an open system, so it's prone to contamination. The two syringe technique, it's impractical for high volume hemostasis screening, and however, it minimizes introduction of tissue thromboplastin to the specimen because the first barrel would serve as the discard tube, and then the second barrel, the sample that is contained in the second barrel, would be the sample to be used for the coagulation testing. Blood in the first syringe is assumed to be contaminated with tissue fluid and is not viable for use in coagulation studies. The next alternative method for collecting the sample is what we call the winged needle or the butterfly set collection technique. So this is useful for collecting specimens, especially if your patient has veins that are small, fragile, or scarred by repeated venipuncture. So you can use the infusion set, the winged infusion set, to collect for the sample. The the set collection can be connected to either a syringe or directly to an evacuated tube. So basically, you can go for the open system or closed system when using this alternative method. However, there is a note here that the phlebotomist must compensate for the internal volume of the tubing, which is usually 12 inches long and contains approximately zero point 0.5 ml of air. So when you're going to use this method for collecting the sample, again, you have to use a non-additive or identical anticoagulated tube, which will serve as the discard tube. So this step ensures that the needle set tubing is filled with fresh patient blood before the hemostasis specimen is collected into the succeeding tube. So you have here pictures showing you guys how the sample is collected using the butterfly set technique. So you can choose whether you want to use the evacuated tube to collect the sample directly, or you can make use of the syringe. But you have to remember that for the syringe, it is an open system, so that means that your sample is prone to contamination. But if you are going to be careful, then the sample could be viable for coagulation testing. So care must be taken so that contamination with tissue fluids is absolutely avoided. Blood for coagulation testing should never be the first tube collected because the first tube will always contain the tissue juice containing the tissue thromboplastin from the initial puncture and may contaminate the specimen and prematurely activate the coagulation system, invalidating your coagulation test result. So when drawing multiple tubes using the evacuated tube system, The blood collected for the coagulation testing must always be preceded by a non-additive or identical anticoagulated tube as a discard tube. So you may go for using a red top tube as the discard tube, or you can also make use of a light blue top tube as long as this tube will not be used for the testing. Here are some specimen collection errors that would require repeat collection of the specimen. So first we have short draw. So whole blood volume is less than 90% of the required volume or less than the manufacturer specified minimum. So always remember that when collecting a sample using the light blue top tube, we have to maintain the 9:1 ratio of our blood to anticoagulant. So meaning to say, if it is a short draw, the 9:1 ratio is not correctly followed. So you have to recollect your sample. Next, you have clot in specimen. The presence of clot in the specimen would indicate that the sample already went premature activation of the coagulation cascade prior to adding the reagents for the coagulation testing. So um, it defeated the purpose of the test, so you have to recollect the sample. Next, presence of visible hemolysis as indicated by the red or pinkish discoloration of the plasma that would indicate in vitro activation of the platelets and also the coagulation cascade, which means to say that the results would be unreliable. Next, you have if the sample is lipemic or icteric. Optical instruments may not measure clots in cloudy or highly colored specimens, so the laboratory scientist would automatically shift to the use of a mechanical instrument for this one. Then you have prolonged tourniquet application. Prolonged tourniquet application elevates the concentration of your von Willebrand factor and your factor 8, and it also shortens the measured time on clot-based tests. So again, the application of the tourniquet should not exceed 1 minute. Then you have specimen storage at 1 to 6 degrees Celsius. So this is a refrigerator temperature. Storage at refrigerator temperatures may precipitate large von Willebrand factor multimers and destroy platelet integrity. So as much as possible, after you have collected the sample, you have to process also the samples immediately. Next, specimen storage at greater than 25 degrees Celsius. Storage at above a standard room temperature can also cause the coagulation factor 8 deterioration. Okay, so again, you have to process your samples within the specified processing time to avoid deterioration or precipitation of some of the factors that are found in the sample. For the primary anticoagulant that is used for hemostasis specimen, that is your buffered 3.2% sodium citrate, which is in your light blue top tube. So the advantages of using this anticoagulant are the following. First, it has a closer osmolality to plasma and produces more accurate activated partial thromboplastin time results when patients are treated with heparin or undergoing heparin therapy. Next, this citrate concentration is used as the mean of the normal range in the calculation of the INR or the International Normalized Ratio for PT results. So the blood to anticoagulant ratio is 9:1. So this is the strict criteria that must be observed to avoid errors due to excess anticoagulant. Causes for excess anticoagulant of specimens are the following. You have underfilling of your tubes or short draw. You also have patients who have polycythemia vera or individuals who have hematocrits that are greater or equal to 60%. And you have, if there is excess anticoagulant in the plasma, the effect of that would be, of course, increased PT and APTT results. So note, for patients who are polycythemic or grossly anemic patients, Corrections must be made in the amount of anticoagulant that must be used. We have here the formula for adjustment of the sodium citrate anticoagulant volume for elevated hematocrit. So these are hematocrits that are greater than or equal to 60%. So you have here the volume of sodium citrate that is needed is equal to 100 minus the hematocrit of the patient divided by 595 minus the hematocrit of the patient. The answer of that would be multiplied to the volume of whole blood. So take note that the values of 100 and 595 are already constant in this equation. So why do we not use EDTA or heparin as anticoagulants for coagulation testing? So EDTA is an unsatisfactory anticoagulant for coag testing because it inhibits the fibrinogen thrombin reaction, resulting to prolonged PT and APTT results. And in the presence of your EDTA, factor 5 is unstable. Heparin, on the other hand, it has an activity against antithrombin 3, and it has the ability to inhibit all stages of coagulation, which is the same with your EDTA, would result to prolonged PT and APTT results. For the centrifugation of our sample to obtain the platelet-poor plasma, these are the following things that we need to remember. So, the platelet-poor plasma is required for clot-based coagulation tests, and the qualification of PPP is that the platelet count should be less than 10,000 cells per microliter. The type of centrifuge that is recommended for the sample is the swinging bucket centrifuge, and the advantage of this centrifuge over the angle head is that your swinging bucket centrifuge produces a straight level plasma blood cell interface, because your angle head centrifuge would cause the platelets to adhere to the side of the centrifuge tube. For the speed of centrifugation to be used in order to obtain the PPP, we can make use of either of the following: 2000 times gravity for 10 minutes. This is according to Olisinski in 1998. You can also use the 2500 RPM for a minimum of 20 minutes by Turgeon in 2012, or the 1500 times gravity for 15 minutes, and that is according to Fritzma in 2010. So after you have placed a sample inside a centrifuge, of course, the platelet-poor plasma will be separated from the red blood cells. So the PPP must be removed immediately using a plastic or silicone-coated pipette and stored in a stoppered, likewise plastic or silicone-coated tube. The reason for this is that we have to use a plastic test tube to avoid the premature activation of the coagulation system. So again, the recommended type of centrifuge for obtaining our platelet-poor plasma is the swinging bucket centrifuge. And to be able to distinguish this one from the angle head, your swinging bucket, before the rotor starts to spin, the samples are in vertical position. And when the rotor will start spinning, there is a change in the position of the samples from vertical to horizontal. Okay, so after 15 minutes or 20 minutes, this is your PPP. And again, you have to remove this one using a pasture pipette and transfer the sample into a plastic tube or a silicone coated tube. Now for the specimen handling, let's try to look at the effects of temperature on our sample. So hemostasis testing, unless specified, must always be performed at 37 degrees Celsius. In vitro, since coagulation testing is done outside the body, we have to make use of the water bath to mimic the 37 degrees Celsius of the body temperature. Um, if left at room temperature for an extended period of time, let's say more than 6 hours, factors 5 and 8 are likely to deteriorate. So meaning to say, these factors, 5 and 8, are called labile factors Okay, so they easily disintegrate if the sample is not processed um, immediately or in less than 6 hours. Factors 5 and 8 are also likely to break down at temperatures higher than 37 degrees Celsius. Next, you have factors 7 and 11. They are prematurely activated by cold temperatures, um, especially at 4 degrees Celsius. Okay, that's why we have palatandaan for this, malamig sa 7-11. That means to say that these factors are activated at cold temperatures. Another thing that we need to look at is the storage and time for our specimens. Just in case you cannot process them immediately, you have to take note of the proper storage and for how long do we need to store our specimens prior to processing them. So specimens must be processed and subsequently tested as soon as possible following blood collection. This is to ensure that all the clotting factors um, in the sample are present and can be detected by the coagulation tests to be performed. The maximum storage time for uncentrifuged specimens provided that the tubes remain closed. For PT, for prothrombin time assay, storage time should be 24 hours at 18 to 24 degrees Celsius. So that is room temperature. And for APTT, that is 4 hours at 18 to 24 degrees Celsius. For centrifuge specimens, if cannot be tested immediately, should be held for a maximum of 2 hours only at 4 degrees Celsius. Okay, so you have to take note of the condition of the specimen that you are going to test for the coagulation studies. So that was all about your specimen for coagulation testing. I hope you learned a thing or two from this lecture. If you have any questions, kindly ask your laboratory preceptor. And thank you so much for listening to this lecture. I'll see you next time.